Okie dokie. Gonna make this a pretty quick one today, or gonna do one that's easier, so should be quicker. Pulled this one just from the list. Make sure I'm screen sharing. There we go. Zoom in. This one is sort of a case study, so it's different than like a clinical case study. When we talk about case studies, we think like interesting case or a unique case will be presented to a hospital, and then the patient will go under this certain plan that the doctors come up with, and then because it was so unusual and maybe the treatment did or didn't work, the physicians will write a little paper on it, and that's called the case study. This is a little different from that. This is an occurrence of a hockey event in Japan where a lot of COVID was traced to it, so it's sort of like case study of a social event. In 2024, I believe. I'll check. That's at least when the paper is published. I'll see when the data is from in a little bit. I'm going to be drinking my afternoon coffee during this, so I might have to take a little pause here and there to keep it warm. So this paper is called Verification of Ventilation and Aerosol Diffusion Characteristics on COVID-19 Transmission through the Air, and occurred at an ice arena in Japan. So this is going to be a cold environment. COVID thrives in cold and warm environments. Sort of a U-shaped curve where it really thrives in the cold, really thrives in the hot, partly contributing to these summer and winter waves. Hockey arena is a very cold place. It's usually an enclosed place as well, so there's not airflow to the outside. So you're going to have lots of people breathing in this enclosed space. It's cold, so air was going to travel and diffuse throughout the entire place. That's what diffusion is. It's a spreading from a single source all throughout an entire area. I picked this one because it relates sort of to our aerosol one that we just covered in review 12 yesterday. So I thought this was a good next natural step to start thinking about like big spaces and social spread of disease. So this is going to be out of the Hokkaido University in Japan. The paper was submitted April 2024, accepted May 2024, so it's a very fast turnaround. So let's see if we can skim real quick. So this is a hockey game in 2022. So this is when the largest spike from the wastewater data, from what we currently understand of the wastewater data, has occurred. This is when we transitioned into XBB, the Omicron lineages from the previous ones. This was a big evolutionary jump that had a lot of mutations that was able to avoid prior immunity from vaccination, and then also it had a high ACE2 binding affinity, or at least the initial ones didn't have as much, but the later ones did, and that allowed it to spread very fast amongst people and also to evade the prior immunity. So it was a lot of spread really fast for that time period for COVID. So this is kind of going to combine a lot of things from the looks of what we've covered recently. So this study is about a COVID-19 outbreak and ventilation measures taken against COVID-19 transmission through the air, and occurred in an ice arena in Japan. The ice arena has been known to have a deterioration of indoor air quality affected by carbon monoxide and nitrogen dioxide, and so on. So these are going to be sort of indoor air pollutants. The ice arena has been known to have a deterioration of indoor air quality. Oh, reread that sentence. And a total of 172 persons were infected with SARS-CoV-2. So they did transmission contact tracing of these people, and 172 people were found to have an infection, and it was traced back to this event. So this is a super spreader event. Including, so 172 people were infected with COVID, including the players and the spectators related to an ice hockey game in 2022. Given the suspected transmission through the air as one of the infection routes, the primary objective of the study was to investigate the COVID-19 outbreak to verify the ventilation characteristics and aerosol diffusion characteristics. So they're saying that we have a bad ventilation system that we're working with in this hockey rink. It's an enclosed space. There's a lot of people. Prime event for a COVID spread. And there was a lot of COVID that was transmitted to the people from a singular source or multiple sources at the event. And they're trying to figure out, I guess, what caused it. So additionally, the possibility of COVID-19 transmission through the air and the potentially effective ventilation measures in an ice arena are discussed, or ineffective ventilation measures. It was determined that the virus containing aerosol was released from a player in the rink, so they were able to contact trace all the way back to a singular player on the ice. So that's kind of crazy that a person on the ice, because of the diffusion of them just breathing heavily and just throughout the game from their shifts, and then just sitting on the bench breathing normally, the COVID was able to spread throughout the arena and infect maybe other people on the ice, the referees, the audience members in attendance. So it kind of spread from that single player outwards. And this was a central person in the ice, which everyone is around. So it's like a very good scenario of studying COVID spread in a large enclosed environment, and why that method of detection for aerosol transmission from the last study is going to be really important for things like this. So after that, it was highly possible that it diffused from the player benches to the spectator seats due to the players' movements under this unique air conditioning and ventilation system. Judging from the results of genomic analysis, ventilation characteristics, and aerosol diffusion characteristics, the possibility of COVID-19 transmission through the air cannot be ruled out in an ice arena, which we know it's airborne spread, but this is like something that was still in debate at the time for the droplet transmission. And the results of ventilation measures implemented in response to this problem confirm that the integration of a lower level exhaust fan based on cold air characteristics into the existing ventilation system is a relatively straightforward solution with the potential to be highly effective. So they're just saying, like, if we improve the air ventilation system, maybe not as many people would have been infected. While there is an option to refrain from using the ice arena in the event of an increased risk of mass infection during a pandemic, the findings of the study will contribute to an option to facilitate the smooth operation of ice arenas while implementing ventilation measures. So this is very interesting because we know that great ventilation is not going to it's going to reduce the number of infections, but it's not going to prevent infections from occurring. So they're basically saying, like, we don't want to shut down and hurt our commerce for these ice hockey events. We want people to be able to come in to attend, even if there's a pandemic going on. So we think that the best thing to do is going to be work on the ventilation system to make sure that the air is nice and clean. It turns over frequently. Clean air measures, essentially, but clean air measures alone aren't going to prevent this, especially during a pandemic with novel viruses, or just our routine current pandemic virus of COVID-19. So it's a weird jump, but this is going to be a good case study of how this happens for super spreader events. So an ice arena is categorized as a specific building for the special use of various entertainments. In previous reports on the air environment and ice arenas, measures against air pollution from the exhaust gas of ice-making trucks were investigated. So these are the Zambonis that go around and clean the ice. I guess the fumes that those Zambonis give off, the carbon monoxide and nitrogen dioxide, is an air pollutant that is harmful to people, and that these Zambonis, that ventilation system isn't effective at clearing out the ventilation or like the pollutants from this environment. So this is something that they were studying prior in this specific ice rink. And evaluated methods for reducing air pollutants, emphasizing the importance of ventilation and reducing resurfacer operations for maintaining clear air quality. So they're saying that not only are we going to increase ventilation, but we're going to decrease the amount of times that we Zamboni the ice. So maybe like between different like youth sports activities, they wouldn't clean the ice between sessions. So you'd have to, bless me, it wouldn't have to, the Zamboni would be out less frequently, so there would be less pollutants coming from the Zamboni, essentially. Unit all monitor nitrogen dioxide levels in the ice skating rink in the greater Boston area, identifying ventilation as a key factor in mitigating indoor pollution from ice resurfacing equipment. So another thing that they can do is when you don't have a Zamboni, you can literally use buckets of water and mops, basically like large squeegees, and you can just push it around and clean the ice that way. So that's like an alternative. It takes forever though, versus Zamboni just going. But Pentanol investigated indoor nitrogen dioxide concentrations in Finnish ice arenas, highlighting the influence of the ice surface or power source and arena volume on pollutant levels and recommending abatement measures. Gao et al. Monitored indoor air quality in Hong Kong ice rinks, finding elevated levels of pollutants attributed to ice resurfacers with combustion engines, indicating potential health risks for occupants. So maybe even just having like a hybrid of those or an electric Zamboni would be beneficial. Salonen et al. Analyzed health risks associated with poor indoor air quality in Finnish ice arenas, identifying emission sources and advocating for regulatory measures to ensure safe sports environments. Related to that, Drake et al. Reported a case of respiratory influenza or respiratory illness linked to toxic indoor air pollutants in an ice arena, emphasizing the importance of identifying and addressing environmental hazards in recreational facilities. In addition to carbon monoxide and nitrogen dioxide, Bragazowski et al. Assessed indoor air quality in an ice rink, finding higher bacterial concentrations when the ventilation system was off, and highlighting the importance of ventilation for maintaining a healthy indoor environment, because as you pull out bacteria, mold, fungus, viruses through the ventilation system, you're pulling that out, theoretically trapping a lot of that in the filters, and then bringing clean air from the outside in. So that's what the systems do. The HVAC systems, very important part of life, at least in our modern day. And do it all investigated indoor particulate matter less than 2.5 micron concentration in a renovated ice sport venue, finding a strong correlation with the outdoor particulate matter less than 2.5 micron, and recommended specific temperature and humidity controls for audience comfort and air quality improvements. Interesting, I guess. So that's another thing they can do is control the the temperature and the humidity in the place. So maybe having it more dry, less humid would be beneficial. Having higher temperatures would probably be beneficial as well. On the other hand, ice stability and the prevention of fog are primary objectives of the air conditioning in these ice hockey rinks. I've literally never skated on an ice rink where there was fog in it, so I've never seen that happen. And ice stability, if it's too warm, the ice will start melting, and then you'll start slipping and catching your blades on it. It's not fun. I've had that issue before. Used to play hockey a long time ago. There is a concern that dense cold air stays above the ice rink, causing poor ventilation in ice arenas. Regarding studies on energy saving and ventilation system, Pichet et al. Compared different ventilation systems in Canadian ice rinks, demonstrating energy and cost saving achieved by using warm air from refrigeration systems for ventilation or employing heat exchangers. That's interesting. Yeah, I won't explain refrigeration systems for now, but they're very interesting how they work. Lee et al. Proposed a zoning air conditioning scheme for ice arenas with different ventilation systems for the ice arena and spectator stands, aiming to maintain sport standards near the ice while providing a comfortable environment for spectators. A lot of times they have heat bars in the midsection of the audience so that the people are warmer than the players because they're not moving around a lot. So it's going to be very cold for the spectators. No one wants to be cold. So a lot of times they'll have that in some ice arenas. And other ice arenas, they literally have this blocked off stand and they keep the temperature there warm. So you just watch it through this pane of glass at the ice down below. Usually it's up on a secondary level and you're watching down at the ice rink. That's something they do for parents as well. And also allows them to have all the snack things in that area, so they make money. Len et al. Conducted on-site measurements to ice arenas to study the impact of air distribution systems on temperature and humidity, finding significant variations in and proposing statistical models for precise environmental control. The COVID-19 pandemic occurred in a situation where both energy saving and good air quality are required. According to COVID-19 related studies, Krug et al. Evaluated the effectiveness of return to play protocols in preventing COVID-19 transmission in youth ice hockey, implementing stringent measures resulting in no within program COVID-19 transmission despite high community incidence. However, outbreaks of infection at ice hockey games have been occurring worldwide. Q-Tenon et al. Reported on a COVID-19 outbreak in an amateur ice hockey team, highlighting the potential for asymptomatic carriers to spread the virus and advocating for protocols to prevent team-to-team transmission. In the U.S., an outbreak of infection at an ice hockey game was also reported, showing this is an isolated incident. Furthermore, a large outbreak of infection occurred at an ice hockey game held in Kushiro Ice Arena in January 2022, which I believe is the one we're looking at in this study. The outbreak of infection was investigated and it was found that the COVID-19 outbreak could have occurred between players or team members and spectators who were at a long distance. Okay, so I don't think this is the study, but a similar time in place. This large case involves spectators, is very different from other cases and should be investigated from epidemiologic and engineering approaches, given the suspected transmission. What the heck? Get out of here, little guy. I don't want widgets. Bear with me as this goes away. There we go. The large case involving spectators is very different from other cases and should be investigated from an epidemiologic and engineering approaches, given the suspected transmission through the air is one of the infection routes. It is crucial to implement ventilation measures that align with the unique characteristics of ice arenas. Regarding airborne transmission as the COVID-19 pandemic persists, major health authorities such as the World Health Organization and the U.S. Centers for Disease Control and Prevention have acknowledged the significant of airborne transmission of SARS-CoV-2 in 2020. So again, like people are like, oh, they didn't tell us that it was airborne. Like we have documentation that very quickly within the first like 6 months of the pandemic, by July 2020, I've documented this in my COVID transmission playlist of the World Health Organization documents on this. They acknowledged that there was airborne spread back in July of 2020 when like most countries like the US declared a pandemic state in March 2020, April, May, June, July. That's 4 months that it took them to do that. So like it was relatively quick in terms of a scientific approach sense. So you'll see a lot of articles recently that are like, oh, they should have told us the blah, 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 blah. Like they didn't know, number one, and they figured it out pretty darn quickly. And there was also some other factors at play at the time, like there wasn't a stockpile of masks for healthcare providers. So part of it was, I think they already like had intel that it was airborne back then, towards the beginning of the declaration in March. But what they had to do was not put people in a panic and buying up all of the PPE supplies. I'm not saying that was the right thing to do whatsoever, but they did that to try and preserve PPE so they could try and get it to the right people, which is the healthcare workers and the frontline workers, mostly the healthcare workers. So that's what they were trying to do with it. I don't think that was the right approach. I was wearing a mask even before they said wear a mask because I was like, I'm not going to be screwing around with this stuff. But publicly, the World Health Organization declared that it was definitely airborne spread by July. And I think there was even a May suggestion of it a few months earlier. So these are things like very, very quick. They happened. And the importance of short range airborne transmission in 2021 in a recent development, the report defines the phrase transmission through the air and emphasizes the importance of ensuring adequate ventilation as one of the public health measures. Although the building types and spatial scales differ from an ice arena, the effectiveness of ventilation measures against COVID-19 has been documented in various research papers. Therefore, the primary objective of the study was to investigate this particular COVID-19 outbreak, to verify the ventilation characteristics and aerosol diffusion characteristics, and to discuss the possibility of COVID-19 transmission through the air and the potentially effective ventilation measures in an ice arena. So on 15 and 16 January 2022, Asia League Hockey Ice Games were held, and members of two teams, Team A and Team B, the officials in the games, and the spectators were infected. As shown in Figure 1 and Table 1, players and staff members of teams were the first to develop COVID-19 following SARS-CoV-2 transmission among officials and spectators. Out of the 172 infected persons, 102 were spectators, 59% of all infected persons, and all 42 players were infected. Wow, 100% infection rate of the players. 100% positivity rate. The virus was classified as the Omicron variant BA1.1.2 by genomic analysis. So they confirmed that everyone had the same variant. So they're able to say, like, a person from this hockey team transmitted to all the people because it was the same variant upon sequencing. And at this time, there were several different variants. So if other people had brought COVID in as well, they would be different variants that they sequenced, and they'd be like BA 1.1.2 and then like BQ.1.1 or something like that. As shown in Figure 2, positivity rates among spectators varied depending on the location of the seats on both 15 and 16 January 2022, which is why they probably started looking at the diffusion characteristics, because people seem to be concentrated in specific areas of getting infected for the crowd. The rate was based on the location of the seats. The rate was 0% to 29%, and the number of infected persons was particularly high on the west side near the players' benches. So this is showing, like, the closer you are to the infected person, the more likely to be infected. But still, the further away you are, you can still get infected. So players on Team B and staff members on Team B got infected, players on Team A and staff members on Team A, and then there's the original source, the start of the infection, 112. So the person came to the rink knowing that they had a COVID infection, and then they were able to spread it amongst their team and other players from the other team. So we have a player here, and then the earliest infection from Team A. So we're able to isolate, oh, Team A is the one that had the initial infection. We know that this person had it. Then they probably infected a couple other members of their team. So maybe like 2 or 3 people. Well, we can actually see. So 3 people and 1 staff member, 1 coach, were infected on 1/16. So when was the game? Let's be specific. When is the game? Yeah. So the game is the 15th to the 16th. So these people, so there's 1 person that was infected beforehand. They infected a couple members of their team, and 1 staff member, 1 coach. These 4 people were infected on Team A, and then they infected other people on their team through the play and sitting on the bench. And then members of the opposing team, in addition to members of the audience, where we're having people show initial symptoms 1, 2, 3, 4, and 6 days after. So very quick incubation period, because back then it was very short. It was about 24 hours, 24 to 48 hours before you'd start showing symptoms. And then here is the distribution of positive spectators. So they broke it up into quadrants of the stadium. The players' benches are over here. The officials' benches is over here, which also means that the penalty box is going to be here and here. So throughout the game, an infected player might be also sitting in the penalty box, which is possibly how these people got infected. But you'll see here the players' benches where the infections occurred. And does that still happen? No, that's only in youth sports. I was going to say, I think halfway through the game you switch benches, but that's only in youth sports. I don't think professional teams switch benches throughout the game after the halftime, second quarter. So player bench A is where the infections were. We have between player bench A and B the highest number of infections, and then we sort of have an equal spread of infections throughout, with the next highest being on the opposing side, and then off to the corners, and then off to these corners, with the least being over here and over here. That might have just been a function of the game because most of the game occurs in this region right here, with less action typically occurring in the goal side of the game. So that's probably why the center is sort of like the highest zone of spread. But you'll see that people in essentially all sections except for section I had infections, and then also section E. So you're seeing that it's diffusing all throughout the arena. So on the ice rink, the physical contact between players and the closeness of players and referees was seen, but it's natural to think that there is no contact or closeness between spectators and players or staff members because there's like glass all around the rink. There are nets. There's no chance for fomite to occur because those giant sheets of plexiglass are going to block any droplets. When people get hit, it's not going to go everywhere. So that means that only aerosol is going to be infecting the people around the rink, not droplets. On the ice rink, several players and staff members developed COVID-19 earlier than the others, so they may have been infected before the games. It was presumed that virus-containing aerosol released from infected players in the ice rink floated to the seats of the spectators, and some spectators were infected. The amount of virus an infected person releases differs widely when a person's metabolic rate and with or without a cough. So, like, because they're exerting themselves very strongly for about a minute to a minute and a half at a time, or 45 seconds to a minute and a half at a time for a shift, people are breathing very hard, which is puffing out lots and lots of aerosols while they're going through extreme work. And then they're going to be out of breath by the time they get to the bench. So they're going to be puffing, puffing, puffing towards the crowd as well, and then amongst their teammates. And then if they're coughing at the same time while they're on the ice or off the ice, that's also going to expel even further the particulates. A person's metabolic rate differs with his or her physical activity, and an ice hockey player's metabolic rate in a game is supposed to reach nearly 10 times as high as that at rest. Regarding studies on ice hockey masks, Shaw et al. Conducted a randomized crossover. So ice hockey masks, typically just a visor. For a lot of people, they think it's cooler. Sometimes you have the cage mask, but all of these have completely adequate airflow, so it's not going to do anything to protect people from not getting stuff. So that could even be an implementation measure, is having sort of like more of a shield type visor, so that it acts sort of like a fomite dampener. It's not going to do much for the aerosols, but it'll do something. So that could be something that could be implemented as well, but hockey players probably wouldn't use it because they're not going to think it's cool, which is why most players wear like tinted visors that they think are so cool. To assess the effectiveness of wearing face masks on performance in youth hockey players, concluding that mask wearing had no significant impact on performance or physiologic parameters. So they're saying even just like you can actually make hockey players wear masks, wear face masks while they're exercising. It's not going to affect their play, and they're still going to have play fine. So that's something people can do as well. Explore the impact of wearing face masks on the lower visual field, and youth hockey players find the mask wearing obstructed vision could compromise safety during play. I'm skeptical of that. I'm not sure what kind of masks they're using that are obstructing their vision. That's suspect. Compromising safety during play, again, not seeing how that can occur. Although there's a divergence of opinion on this matter. Yeah, that sounds more like opinion than actual facts. When we have a study here saying no impact on performance or physiologic parameters, then we have a person being like, oh, it could obstruct your vision if it like flips over your eyes or something. I don't know. This sounds like a bunch of bullshit. Although there's a divergent opinion on the matter, the players and the referees did not wear facial masks at the game. That was something that was elected not to do. For reference, an ice hockey game is played in 3 20-minute periods with 2 15-minute intervals, which ice making is conducted by ice resurfacers. In Kushiro Ice Arena, electric ice resurfacers are used. So that's interesting that they have this problem with the carbon monoxide and the nitrogen dioxide, despite using electric ice resurfacers versus like diesel machines. So that's kind of weird. They're still having that issue, despite the use of electric Zambonis. Gotta swish with some water. So Kashiro Ice Arena is a two-storied building of reinforced concrete construction built in 1996. Its building area is 663 meters squared. Its floor area is 7,564 meters squared. And its seating capacity is 3,739 seats and 1,200 standings. It has an ice hockey rink that measures 60 meters by 30 meters in size. There are benches for players on the west side and the official bench on the east side. The ice rink is surrounded by opaque walls and transparent protective panels. These walls and panels protect spectators from hockey pucks. The opaque walls around the ice rink are 1.07 meters high from the ice surface, and transparent protective panels are 1.8 meters high. So that's about 4 feet? Let's see, 1.8 meters, 2 feet. Oh, 6 feet. My math is off. Oh, I always do pound kilogram conversions instead of meters to feet. I always mess that up. There are benches for the players on the west side and official benches on the east side. I already read that. The opaque walls around the ice rink are 1.07 meters high from the surface of the ice, and transparent protective panels are 1.8 meters high on the east side and 2.4 meters high on the south and north sides. Figure 3 shows cold airflow from the ice rink to the players' benches. There is no protective panel near the players' bench on the west side, and our smoke tests prove that cold air on the ice rink spreads out of the players' bench. On the other hand, there are protective panels on the east side. The doors of the goal storage space near the officials' bench were closed during the games, and the smoke leakage from the door gaps was not recognized in the smoke test. So this is showing slow cold airflow from the ice rink. So it's showing that it's very easy for for everything to spread amongst the people within the ice. I'm not really seeing it go over the concrete walls here. So I'm guessing it's more just showing that the players are definitely infected because it's spread straight across. Figure 4 shows the air conditioning and ventilation system. 2 air handling units, AHU, are set on the north side of the second floor. Supply air is provided diagonally downward from the 9 circle inlets, 350 millimeter diameter of each of 2 ducts, 900 millimeter diameter near the ceiling of the west and east sides of the ice rink to the central part of the ice rink. There are 2 vents on the north side of the passage on the second floor and are connected to AHU. Air handling units. These are 6 fans near the ceiling. The design ventilation rates are as follows. Outside rates are 12,000 meters cubed per hour. Supply rates are 42,000 meters cubed per hour, and exhaust rates are 12,000 meters cubed per hour. OA, outside air rates, is equivalent to required ventilation rates for 400 persons. I'm not seeing the ventilation, but it should be, I guess, up here somewhere throughout at these different points. So I guess what it's showing here is that the ventilation is pulling air from the ice into the stands. So it's showing that the ventilation system is sort of aiding in the infection, particularly of these people back here. And then the outside supply is at these corners and pushing in. So if the outside air is supplied at the corners pushing in, I guess that's why we sort of see lower rates on these edges. In order to verify the ventilation characteristics of ice, carbon dioxide was generated from a gas cylinder in the ice rink for 5 minutes. Since the measurements were conducted in a cold environment, particularly the utilization of liquefied carbon dioxide gas to discharge CO2 through the rink, a multitude of gas cylinders were employed, and meticulous attention was paid to prevent freezing. When the CO2 concentration at 1.6 meter high became more than 1,000 parts per million at every measurement point, 14 kilograms of carbon dioxide in total. Ventilation frequency at every point is calculated based on the CO2 concentration decline thereafter. The carbon dioxide decay method was based on the Society of Heating, Air Conditioning, and Sanitary Engineers of Japan standard. This method using CO2 related to COVID-19 has been used in several scientific papers. 11 measuring instruments were set up in and around the ice hockey rink. So they're just focusing on the highest areas right here. Where's the results? Aerosol diffusion characteristics. In order to verify the aerosol diffusion characteristics created by the players' movements in the game, the particles from a smoke generator was generated on the ice rink. The amount of smoke was 6,000 cubic feet per minute, and the distance of smoke was 9.8 feet. After the particles spread all over the ice rink, a one-period game was played by professional ice hockey players. The particle concentration at measurement points were continuously measured for 1 minute. As the measurements were taken during a game, only the center of the ice rink was set up inside the ice rink to the extent that it did not interfere with play. The ventilation frequency was calculated using the same concentration decay method as for carbon dioxide, focusing on data outside the ice rink due to the limited conditions known under the COVID-19 pandemic. The number of measurements on ventilation characteristics and aerosol diffusion characteristics was limited to 1 each. So they have west, north, east, south. Temperature in degrees. Here we go, data. Carbon dioxide concentration at 1.6 meter above the ice was lower than at 0.6 meter above the ice rink at every measuring point. On the other hand, the carbon dioxide concentration of the player's bench was almost the same as those at 1.6 meters above the ice rink. The carbon dioxide concentration at the south player bench was higher for most of the time than at the north player bench. The carbon dioxide concentration at the officials bench at the west entrance was lower than those at the player benches. The carbon dioxide concentration of the spectator seat was under 800 parts per million and lower than those at the ice rink, and players' benches in the west entrance. The order of high carbon dioxide concentration space is lower. The player bench than the middle parts, 1.6 meter above the ice rink. The west entrances and the spectator seats. Figure 8 shows the ventilation frequency calculated from carbon dioxide concentration decline from a quarter hour to 0.45 hours. In figure 7, under the condition that there was a carbon dioxide concentration difference between places in one large space, the ventilation frequency was calculated from carbon dioxide concentration decline caused by the difference between the CO2 inflow and outflow at each measurement point. The ventilation frequency at the lower part, 0.6 meters above the ice, was the most, 2.3 times per hour at the east part, and from 1.24 times per hour to 1.4 times at the other parts. So we had the most ventilation on the east part, least on the west part, which I guess is correlating with the data, having higher ventilation areas being lower in the carbon dioxide concentration. And here we go, aerosol diffusion characteristics. Figure 9 shows particle concentration for a one-time game by professional ice hockey players in accordance with the smoke generation. So they're having smoke being generated at the center of the ice, and they're having players just play around it for a game and seeing how that spreads. And we see, so yellow, very low in the west center, which is weird for particle concentration. Very high in the south center, high in the west-south entrance, and high in the north player bench. So it looks like the northwest and south are the highest smoke generation. And then it was pretty equivalent for these low seats, is what it seems like. Figure 10 shows the ventilation frequency calculated from particle concentration decline during the game. The ventilation frequencies of the player bench and the west entrances were from 0.9 times per hour to 1.6 times per hour. They were not so different from carbon dioxide concentrations calculated while the game was not being played. However, the ventilation frequencies of the spectator seats were from 1.1 times per hour to 1.6 times per hour, and they are much higher than those from carbon dioxide concentrations. The difference contrasted with the stable and accumulated cold air conditions, where aerosol diffusion into the spectator seats was facilitated by adding the player's movements. It was presumed that this results in air circulation in the upper and lower layers, thereby expediting the decline in particle concentrations in the spectator seats, showing that there's just like higher concentration of particles that just naturally occur within the ice arena versus having it outside the ice arena in the spectator stands, mostly because of these fans, these HVAC systems. So they're saying a way of preventing the outbreak of infection by controlling virus-containing aerosol diffusion was verified, and the following ventilation measures was designed. As shown in Figure 11, an exhaust fan was set at one of the player entrances to exhaust cold air staying in the low part of the ice arena, and to control virus-containing aerosol spread from the ice rink to the spectator seats. So they're basically setting up large ventilation fans at strategic locations to blow air back into the rink, to prevent it from accumulating in the stands. So their solution is to blow it back at the players. So I guess it would raise the infection risk of the players, but lower the infection risk of the spectators. As shown in Figure 12, particles released from a smoke generator set at 0.8 meters high at the side of the ice rink. The number of particles at the measurement point were counted under fan off. Smoke was generated for 5 minutes at first, and then 3.5 minutes under the fan. Figure 13 shows the visualization of particle dispersal when the images at 16 minutes after smoke stopped were compared. The smoke on the ice rink moved in the following ways. Under fan off, the smoke stayed on the north part of the ice rink, while the smoke stayed at the lower layer of all over the ice rink. Under fan on, in the spectator seats, the smoke stayed under fan off. These results of visualization show that under fan off, the smoke on the ice rink spread to the spectator seats, and the exhaust fan prevented smoke from going upwards to the spectator seats. So the fan is just essentially blowing back to prevent air from going into the spectator seats. So again, it might be a protection measure for the fans to some extent, but not necessarily for the players. So here is the smoke example, smoke in the spectator seats when you have it in the center ice, and you can see it's kind of going out everywhere. And then here is the fan off versus fan on. Okay, I was confused for a second. So A is fan off, so you can see it's fusing out to the spectator seats. B is fan on, so you can see it's very clear. So look at this space right here versus this space right here. So under the same conditions, you can see that it's not going into the stands behind the players' benches as much. So the fans are doing a good job. And then here are the fan off and fan on measurements of the smoke particles. So they're pretty high. We have the highest on the south, and then less on the north. Then at the same seats, they measured it again. And with the fan on, they're providing a certain degree of protection to the audience members. Again, it's not going to be a perfect protection, but it's something. So they're saying this is something that could 100% be done, but again, this is going to be very loud. I don't think people are going to want to like have these fans blowing, and then you could like people could unplug it or something like that. And again, it's not perfect protection. There is some protection for sure, significant protection compared to not having the fans blowing air back at the ice rink. But it's not going to be perfect. So you are going to reduce infections, which is always a good thing. But again, not perfect. Then they're going to go through the limitations. Yeah, so in the study of COVID-19 outbreak and ventilation measures against COVID-19 transmission through the air occurred in an ice arena in Japan, categorized as a specific entertainment place. Were discussed through epidemiologic investigation, through contact tracing. Out of the 172 infected persons, it was determined that 102 spectators and all 42 players were infected. The virus was classified as Omicron variant BA.1.12. By genomic analysis, it is presumed that some spectators were infected by virus containing aerosol released from infected players on the ice rink. It was revealed that cold air in the ice rink flowed from the player benches to the spectator seats using carbon dioxide particles as a tracer gas. The ventilation frequencies in the spectator seats was calculated to be 0 times per hour to 0.3 times per hour based on carbon dioxide concentrations during a non-game, but from 1.1 times per hour to 1.6 times per hour based on particle concentration during a game. The difference can be attributed to the aerosol diffusion into the spectator seats, which was facilitated by adding the players' move-ins. So by having the players move around on the ice, it's providing essentially air vortices, air circling, which can then help to facilitate in spreading the air out. So that's important. If it's just players being still there and you have the same exact scenario, you're not going to infect as many people. But because they're having these like movements that are creating essentially air vortices, if you look that up, it's just like spinning air. It can basically act like a invisible tornado, shoot things up into the air. And the results of ventilation measures implemented in response to the possibility of COVID-19 transmission through the air confirmed that the normalized particle concentration under fan was only 6% compared with fan off. The integration of a lower level exhaust fan based on cold air characteristics into the existing ventilation system was highly effective at these spectator seats. So having these counter fans to blow potential virus containing particles back onto the ice versus out into the audience could help protect audience members, but it's going to increase the infection risk for players on the ice by sort of forcing that stagnant, not stagnant, but like that air backwards at them. The condition of an ice arena is unique because of the maintenance of ice due to the maintenance of ice on the rink and the prevention of vapor condensation, blur on the transport protective panels, and so on. Therefore, in operating air conditions ventilation system, the maintenance of steady air in the ice rink is a main priority. Under this unique air conditioning and ventilation system, virus-containing aerosol released from a player on the ice rink accumulated in the cold air spot. It was highly possible that the outbreak diffused from the player benches without protective panels to the spectator seats in the games. Judging from this outbreak of infection, which included spectators to the study by integrating epidemiologic and engineering approaches, the possibility of COVID-19 transmission through the air cannot be ruled out. So just saying that this is evidence to show that airborne transmission is 100% a thing with COVID-19. And that's it. So I hope you learned something, and we got 2 papers in this weekend. So again, just like that, sort of the highlights of this one, since it was kind of like dense at times, is that they were able to contact trace back to a single player that initiated these infections during the time of the game. There was 3 players and 1 coach that had been infected. These 4 people then went on to infect 168 other people, all the members of the team that they were on, all the members of the opposing team got infected from these 4 individuals, and then these 4 individuals were then able to infect a significant proportion of the crowd, predominantly behind the bench, but then also sporadically throughout the stadium. There was some protection due to the HVAC system blowing outside air in these corner locations. There is also some added risk besides being closest to the player's bench, but also having these vents, these ventilation vents in the back here, which help to pull the air from the ice up there due to the players skating on the rink. This creates for air vortices, which helps to shoot off any gases from the rink into the stands. Their primary solution based off of this very specific ice rink due to the setup is to have 2 fans angled at 45 degrees, one shooting air this way, one shooting air this way, to essentially blow the air back from the players, coming from the players back onto the ice, which could potentially provide a protective effect for the audience in this section, but again, is not going to do anything for the players. It might even aid infection amongst players through this method. But it's showing that despite not directly interacting with a COVID infected person, an entire ice rink, a very large space, a single person mingling about, or 4 people mingling about of known infection, can then infect many people within the same space, despite being very far away from the individual due to the airflow characteristics of the space. And yeah, so that's what we learned. And that was a pretty interesting study. All right, or a case study. All right. Have a good rest of your day.